Hello, everybody. I just wanted to go ahead and get a thumbs up from the people on the that I could actually see if you can hear me okay. Okay, perfect. All right, so we're going to go ahead and get started, everybody. So you guys have all joined the session that's titled Coronavirus 101 for frontline workers. And typically the way we run echoes is we usually have introductions. So we go around. But in this case, because we currently have about 79 participants, we're not going to go ahead and do that. We're going to do things a little bit differently. And I do also realize that some of you, this is your first time participating through Zoom for an echo session. So we're going to use some features in a way of communicating with each other. Okay. So I want to start off with logistics first before we go on and do our presentation. So for individuals, we need you to please chat your information to Bridget. And Bridget, everyone? Okay, let's do that. There's a chat function at the bottom of your screen. We want you to go ahead and click on that. And please provide us with your name, your organization that you work for, and also your email address. We want to track participants, and that way we can make sure we send you out information on future sessions. Okay, so we'll do another reminder at the end just to check in with individuals. All right. The other thing is the chat function is also going to be used for you guys to chat us questions or if you're having IT issues, okay? So just because with this large of a group, we're gonna be using that feature. Just know we're gonna try to get to all your questions, but if we don't, we'll figure out a way to be able to answer some of those questions. Hopefully some of those questions will be answered in the presentation. All right, okay. So as you were doing that, I wanted to go ahead and start off with, this is a collaboration with Project ECHO and the Office for Community Health here at the University of New Mexico. We do realize that there's other individuals maybe from other states that are joining the session, and that's great. Originally, how we were talking and brainstorming this session is actually Dr. Laura Parajon, that's right next to me, was really trying to figure out what should we do for the frontline community health workers here in our state, and very specifically to the programs that we have here in New Mexico. But then we had other interests from across the state of New Mexico, and now it has expanded to other states. So the more the merrier. We're very pleased to offer this service because we know it's a critical time for people to be getting the most up-to-date information. So with that, we have about 96 participants now. I'm going to go ahead and start us off with our presenter. We do have a total of 3 presenters that will be chiming in and out throughout the presentation, but the main presenter is Dr. Laura Parajon, and she works for the Office for Community Health. And I'm going to kick it off to you, Laura. And actually, before we kick it off, we should probably do introductions for the people that are here in the room. So,
hi, everybody. My name is Paige Menking. I'm the Director for Community Health Worker Programs at the ECHO Institute here at the University of New Mexico in Albuquerque. And Bridget's a little off camera, but
I'm over here, Bridget Quinn. Where am I? There I am. I'm over here, I'm Bridget Quinn. I'm a program manager here, and thank you all for sending me your information. I really appreciate it.
there we go. Hi, my name is Virginia Chivit-Sidor, and I'm here with the ECHO Institute as well, and I also work on pretty much every CHW program.
Hi, this is Yuki from Project ECHO IT. If you have any issues with IT, just check me. Thank you.
All right, and I am Vanessa Valles, and I work for the Office of Community Health under Community Health Worker Initiatives, and I will be your facilitator today. But I'm going to go ahead and pass the baton to Dr. Parajon. Oh, the other thing, thank you, team, is you are all muted, okay? And that is, we did that on purpose because of the high number of participants. If you want, we will unmute you. If you have a question, please raise your hand. And it's interesting because I can't see everybody. So for those that have the camera, if you can raise your hand, and the rest of you that we can ask, it will be used through the chat function, okay? The other thing in regards to my facilitation is I'm gonna do a time check. We have until 5 o'clock today to finish our presentation, but I will be monitoring time in regards to how many questions we can answer at one time, okay? All right, perfect. Go ahead.
Great. Hi, everybody. So my name is Laura Chancellor-Hone, like Vanessa said, and I'm super excited to be here with you guys today. Like Vanessa said, I'm the Executive Director for the Office for Community Health, but I'm also part of the medical team at Amos Health and Hope in Nicaragua. So I've worked with hundreds of community health workers. Oh, I'm looking at the wrong place. Sorry. Hi. I've worked with hundreds of community health workers throughout Nicaragua. So community health work is very close to my heart. So I'm not here as an expert on coronavirus. I'm here as a physician who loves community health workers. And so I'm so excited to be on a call with, it sounds like 100 community health workers. So that is super exciting to me. What we want to do today is really give you some understanding of what the coronavirus is. And like I said, I'm not an expert. This came from a grand rounds at UNM that was given last Thursday, as well as information from the CDC and the WHO, and also the New Mexico Department of Health. So what I'm trying to do is just kind of pull together a lot of information. We also have Dr. Bronwyn Wilson on the call as well. She's one of our physicians. She is the Associate Dean for Faculty Affairs at UNM, but also one of our physicians. So she'll answer some of the UNM physician type of work. And also Dr. Mario Pacheco from our Palaque Clinic, which is a rural clinic. So we have a mix of physicians here and also people who can try to answer your questions. So we're going to try to give some information about the coronavirus.
The video is fading in and out. That's our microphone, so make sure to speak right that way. So,
okay, thank you. Okay. Oh, great. I'm speaking into there. Okay, great. And then we're going to share some like myths and facts about the coronavirus, and then share some of the resources. So that sounds good. That's what we're going to do. Okay, so I'm going to go ahead and click to the next thing. Oops,
Did you click?
Oops. Oh, thank you. Is it this one?
Yeah.
Okay. So these are the learning objectives, and then we'll go to the next slide. So the coronavirus, it's a large family of viruses which can cause illness in animals or in humans. It's mostly known to cause respiratory infections, so that ranges from the common cold to, I'm sure many of you have heard of the SARS, the original SARS, and so that's what coronavirus is. This particular coronavirus is called COVID-19 and also is known as SARS-2. So COVID-19 is it's the coronavirus's name, and it's most recently discovered in Wuhan, China, this December of 2019. So that's where it all originated. One of the cool links that you can get to, and we'll have that at the end of the slides, and we'll share these slides with you, is the Johns Hopkins site. They have a running tally minute by minute of all the cases in the world. So currently, this is their most current picture that we kind of screenshot. And so as of yesterday, there are 118,596 confirmed cases, a total of 4,262 deaths, and 64,427 people recovered. So it's a good site to just kind of go on to. You can see where you are in the world and kind of figure out what's going on in your area. Also, for those of you who are community health workers from New Mexico, this is directly from the Department of Health site. There are 3 positive cases of COVID-19 in New Mexico. And one of them was here in at UNM, and then the other two were in Socorro, I believe. Yeah, so anyways, we want to give you a chance now to say, what have you guys heard about the coronavirus, some myths and facts? And like I said, I'm not an expert, but I have learned a lot about it in the past few days as, you know, more and more information is getting known about the virus. So
Perfect. So for those of you that I could see on the camera, if you want to raise your hand, and we can unmute you and you can ask your questions. This is your opportunity about what you've been hearing. And definitely this is an opportunity for us to correct the information or confirm you're absolutely right, because we want people to have the correct information. For folks on the phone, again, please chat us your question and I will work with Virginia right here and she will read off some of the questions, okay? So I'm gonna go to folks that I could see. Does anybody have, all right, and we have, who is that right there? Can you see, Virginia? Who's gonna unmute? Okay. All right. Darian, go ahead. Tell us.
Hi, my name is Elizabeth Dedarian. I'm from Rhode Island with the asthma outreach programs, the community asthma programs here, part of Lifespan Hospital. And I wanted to know a little more about the rates of recovery and rates of death in people who already have respiratory diseases, if possible, if we have anything.
So Lauda, do you wanna,
okay, so
and you can also refer to anybody else, the other two doctors. Do you wanna hold off on that question or do you wanna answer it?
yeah, we actually just had a grand rounds where they actually told us about that specifically. Actually, I think it's in one of the later slides where we show the percentage of death rate per actual illness. So there are some articles from the Lancet that actually, you know, are from Wuhan, China, where they actually tell the specific percentage of death per kind of illness. I don't have that in this slide set, but I can definitely send it to you. We can send the article and also the percentages, but they're basically what they're saying is that you have a 15%, like the normal death rate is about, it ranges between 1.4% to 3% for mortality rates for this virus. But if you have like COPD or hypertension or diabetes, like, you know, chronic obstructive pulmonary disease or any underlying illness, you have a much higher rate of getting ill and having a serious, you know, have to put on a ventilator and then potentially dying if you have those illnesses. So I can like look that up.
Sure, and I think also, were you also asking about recovery? What's the, right? So are you, so in regards, Lauda, to the recovery, how many days of recovery after once you've been diagnosed? Is that correct? Okay.
Yeah. Is that right? After you've been diagnosed? Yeah, so that's a really good question, and let's put it on because we're going to try to have these like weekly, and so we can bring actual experts and stuff like that. I'm just kind of doing the big picture overview, and I think we're learning from each other. We want this to be a space too for like community health workers, if anybody over there knows or has information, a space to share as well. But what I have here, so I just pulled it up. People with cardiovascular, actually the highest rate when they looked at, when they were looking at the Wuhan set, you know, from China, actually the people with hypertension had the highest rate of death at 21%, and then cardiovascular disease had 9%, diabetes had 8%, and then COPD had 3%. So that's actually a really interesting data set. And I think as more and more cases get known, they'll have more information. But yeah, I can send you the information from this set, from this actual grand rounds that they gave us.
Okay.
We have about 10 more
Questions. Oh, okay.
Perfect. All right, so we'll go through those quickly. So what other questions do we have? Virginia, do you want to read us one out?
Sure. Somebody was asking if it was airborne or not.
Oh, cool. Okay, that is on to the next slide. That we'll go over there. Yeah, but no, it is not. It's not really known to be like an airborne. It's more of a droplet type of. spread.
And then you'll talk about it in the
Yeah, and I'll
next
talk
one,
about it in
okay?
the next few.
What's another
The
question?
next one actually kind of dovetails into that. They wanted to know how many, they've heard that many people can be shedding the virus and not know that they have the virus.
Oh, yay, this is so cool. These are all questions that we have in the next, that are answered in the next sets. Is it okay if I like just save those that are going to be answered?
Absolutely.
Okay.
And others?
Then somebody has asked if it's true that we should not wear the mask if we do not have the disease or the flu or anything, just as preventative
Oh,
measures.
awesome. Yay. Once again, that is totally on this. And these are great questions because I ask those questions myself, you know, as a community person myself and a physician. I think, you know, all of us are in this together. Yeah.
Okay, some of the things that people have heard are recovery within 14 days, and they've heard that steroids have increased morbidity and mortality.
Yes, I think, and once again, a lot of the stuff on the COVID-19 is stuff that's more and more data is coming out, but they did find that steroids did lead to more. Oh, sorry, I'm looking at the wrong place again. That it did show that steroids did lead to more mortality and morbidity is what we found. So all the support is really supportive care. Yeah, that's another thing. So it says it's also heard that post-contagion immunity is short-lived and that you can get it again after recovering. I also looked that up as well, and it sounds like there's.
Can you break that down, Loda?
Yeah,
Just what
okay.
that means.
So after you get the illness, so like, you know, most people who get the illness, it's a very mild illness and you just get better within a week, just like any other cold, a week to 2 weeks. But then there are some data showing that I think that you could catch it again. So that's still research that's being done by, you know, globally, and I don't have the answer to that question. Great. Anything else? Okay, great. So I think a lot of these questions will be answered. Is there anything else?
That's, I think what we're going to do, Loda, is we're going to continue to look at some of these questions. And what we'll do is we'll circle back at the end if your question was not answered in the presentation. Okay? So we're going to go ahead and do that because I think many of these will be answered in the presentation. All right? You can go ahead and go back to the presentation.
Oh, great. Okay, awesome. Thanks for your questions and, you know, myths and facts about COVID-19. So this is one of the answers to the questions. So COVID-19 is mostly spread by droplets. This was also one of the great slides that we got here at UNM from the grand rounds that they did. But it's a picture of when you cough, the droplets that come out. And so people can basically catch COVID-19 if they breathe droplets from a person with COVID-19 who either coughs or exhales the droplets. So if you're too close, you can actually breathe in the droplets and get COVID-19. These are just some, you know, some of the other illnesses that also spray out droplets. So for Ebola, it's about 3 feet. And then measles, it's about 6 feet and more. You know, they actually get even farther. They think that COVID-19 droplets act about at 3 feet. So that's why they're asking people to stay more than 3 feet away from people who are sick. And just to be safe, we're saying 6 feet, you know. So the minimum amount that you can find in all the like kind of WHO literature is basically 3 feet, but then the recommendations go up to 6. Because of the droplets going everywhere, they're recommending that people stay home when you're sick, and also to cover your mouth when you cough and sneeze, because the idea is how do we prevent the droplets from going everywhere? Another question that people might wonder too is how long does COVID-19 live on surfaces? And a lot of this still is just, you know, information that's being found, you know, discovered over time. But the small droplets from your nose or mouth are spread when a person, like obviously cough or exhales, and then these droplets land on objects and surface around the person and can stay anywhere from a few hours to several days. And that's really important to know because that's where people are picking stuff up, right? It's like from a doorknob, from your computer, from, you know, tabletops. And so other people can then catch it by touching these objects. And then, you know, they say you touch your eyes, nose, or mouth like between 150 and 200 times a day. So you're just basically like giving yourself potential COVID droplets as you touch your face. So that's why there's a lot of recommendations around cleaning and disinfecting common objects and surfaces just with like regular disinfectants will work. You know, bleach, Lysol, all those things, if you wipe things down, that would be great. Obviously, all the recommendations around washing your hands with an alcohol-based hand rub or soap and water for 20 seconds to kill the viruses that may be on your hands, and then avoid touching your eyes, mouth, or nose. So like we kind of try to put it so that these are the things that happen on this side, and this is why we do these recommendations. The other piece is like, you know, obviously there's a lot of information and there's so many videos that you can watch about how to clean your hands after coughing or sneezing, but as community health workers, this is something we can really do in our communities, really letting people know about hand washing or using alcohol-based cleaners. I think those of you who are community health workers in organizations or in locations, thinking about trying to keep you know, the hand washing and alcohol-based cleaner available. This is a really cute one too that I think we see a lot everywhere, but like covering your cough with your covering your mouth and nose with a tissue when you cough or sneeze and then throwing it away, or coughing or sneezing into your upper sleeve and not your hands. Here's some fun alternative greetings that we found online. So like in China, they're doing the foot thing where you like greet each other by shaking your feet. Here's some like cute things you can do, like say hello, like with a heart or an earth or your elbows. So just kind of different ways so that you're not shaking people's hands. The other question is can I catch COVID-19 from someone with no symptoms? I think that was one of the questions. So once again, if you just think about COVID-19, it's spread by respiratory droplets. That's the main way we're spreading it. So the risk of catching from COVID-19 from someone without symptoms is actually very low. Many people, though, only will have very mild symptoms. So it is possible to still catch it from someone with mild cough and doesn't feel ill. And that's kind of the issue with COVID-19. It's like, it's around when we also have allergies and other colds. So we can't tell like who just has an allergy, who has COVID-19, you know, who has just a cold. And WHO is actually doing ongoing research on this, on actually who asymptomatic people are actually spreading the disease, that's why the recommendation on avoiding mass gatherings and large groups has come about, because we don't know who has it, it's not clear, and so the closer you are in proximity to others, the more chance you could potentially catch it. So that's one thing. This is a kind of a not so fun one so that I saw online, which was, can I catch COVID-19 from feces? And this has happened, especially in Asia, where there are a lot of like apartment buildings, where they found like some of these apartment buildings, like one person would have COVID-19 and then everyone else in the apartment would get it. And they found that actually feces can be aerosolized, like when you flush your toilet, it can like float up and, you know, go into the air system and then infect other people. So that's just not as common in New Mexico, I think, just because people don't live in big apartment complexes here. But that's why they just recommend like washing your hands after using the bathroom and before eating, and then closing the top of your toilet if you have one, you know, so that it doesn't spray everywhere. But it's a very low risk. It's not like a common one. But I just thought I'd put it in case someone asked that question. So here are some of the symptoms of COVID-19. And if you call the hotline at the Department of Health has a COVID-19 hotline where you can call, and I'm sure other states have it as well, have a COVID-19 hotline. But the symptoms are fever, cough, trouble breathing, or shortness of breath. Those are the three main symptoms. And so at the end of this, when we send you guys the email, we have like kind of collected all the WHO and CDC kind of information guideline stuff that you can just use in your CHW work. but this is one from CDC that shows the fever, the cough, and the shortness of breath. These are the most common symptoms, but some people can have, and this is where it gets tricky, right? They can have aches and pains, nasal congestion, runny nose, sore throat, diarrhea, or tiredness. They're usually mild and begin gradually. And there's also, like I said, some people who get infected but don't have symptoms. One thing that's really important is that if you get shortness of breath, that really is a sign of danger. And so that, you know, and usually what people do is they get this for 7 days where they have like milder symptoms. And then on the 7th day or the 8th day, they get shortness of breath, those who will go on to get very sick. And that group is the group that then goes on to having much worse, you know, outcomes. Okay. And there's a question about how long does it take to get sick after being exposed to COVID-19, and that ranges from 1 to 14 days with an average rate of incubation of 5 days. So like once you've been exposed, generally it's 5 days, then you get sick.
So can I just ask
Yeah,
a question?
sure.
So in New Mexico, I mean, our cases, we were surrounded by people being infected in other states, and people kept asking, oh, not New Mexico yet. But do you feel that 1 to 14 days, maybe we had people infected before, or it could show up after 7 days? I guess that's my question.
Oh, yeah, right. Like the range is between 1
Yeah.
and 14 days. So someone could be walking around without symptoms for 13 days and then get it on the 14th day.
Right.
Yeah, and then I mean, the most common is 1 to 14 days, but they have shown like even up to like 3 weeks that people can show up with. So that's why also I mean, I think a lot of people are wondering here in New Mexico, like, why are we canceling classes? You know, why are we canceling big events? You know, and it's because of that. The concern is about containment, you know, so we're concerned that that some people can be infecting others. So the more we can kind of contain the virus and not have it spread, the better it is for people, because of the next slide I'll show, which actually shows like what happens if you do get really sick with coronavirus. The other question is that what should I do if I'm traveling to an affected area? And actually the CDC actually recommends avoiding the non-essential areas to China, non-essential travel to China, South Korea, Iran, and Italy. This list is constantly changing every day. This is actually really important for, I think, for community health workers to know, is that they're recommending that people older than 60 stay at home as much as possible, just because of the illness. Oh, and I see Dr. Wilson on, as well as Dr. Pacheco, so please feel free to add anything as we go through this. The other question is, who is most at risk for COVID-19? And that, like I said, the reason why we're asking people over 60 to not go out as much is because this is a risk group that is most likely to get affected with more severe cases. So people with medical problems like high blood pressure, heart disease, lung problems like asthma or chronic obstructive pulmonary disease, COPD, or diabetes. 80% of the people will recover from the disease, but because 1 out of 6 people will get seriously ill, that's the group we're trying to protect. So as community health workers, being able to share with your community that, you know, please have your older people not go out as much is going to really protect them from getting sick. I don't know if Dr. Wilson wants to say anything, or
Dr. Pacheco, can you hear us? Okay, perfect. I just wanted to, so were you able to capture that, Dr. Pacheco, if you wanted to chime in, and who was the other?
Dr. Wilson.
Okay.
I don't know if they want to add anything. Did you want to add anything? Oh, raise your hand. Oh, yeah, she does. Okay.
I think that's really important for everyone to understand. It's about risk. It's not just age. Obviously, our immune systems get, less effective as we are older, but also all of those other medical problems that people have. So it's not just the age. So folks in those other with those other conditions, even if they're a little bit younger, that's really important. And I do appreciate how hard that is, because a lot of older folks are isolated, but it's a risk balance thing. And so thinking of other ways to stay in community with them, that doesn't mean face-to-face visits or taking people to places which have a lot of other people.
Thank you.
Thank you. That's great.
And this is Paige. I will say that was a good question that we got from the audience, was how do we socialize 60+ community while asking them to stay at home? So if anybody in the audience has good suggestions for that, we'd love for you to chime in with those in the chat.
Perfect. And this question really came up. We were discussing it yesterday with amongst our programs. Dr. Pajaron was thinking, should I cancel home visits for our community health workers? Or then how do we also stay in touch with our 60+ community? And if they're sick, encouraging them to go to the doctor. I mean, that was just a conversation that was coming up for us. So we would love to hear from you all. What has been suggested in your areas? And I am going to call on somebody because I can't see their hand. Naomi. And Naomi, can you, we're going to unmute you. You are unmuted. I believe you had your hand up?
This one he has stroking twice.
Okay. Well,
No, okay.
I think Elizabeth?
Let's see, Elizabeth, where, okay.
you're
Hello
unmuted.
again. So, the question was how to reach out to people who might be isolated.
Yeah.
Sorry, it was breaking up a lot. So a lot of things have been canceled or are getting shut down here. Maybe doing events that would enforce a bubble, something like movies at the community center, but placing the chairs farther apart. Having fun educational things like hand washing, but with prizes or something. Or the black light one, where you put the lotion on, show the black light, and have people wash. You know, those sort of fun educational things might work.
Thank you. Do you want to keep moving, Lotta, or do you?
I had one other suggestion I can chime in
Yeah.
with too. I know my grandmother used to participate in these conference calls specifically for seniors who were homebound. And so she was able to call in. It was very low tech, just with her landline phone. And they had kind of planned activities that would be facilitated by somebody at her senior center. And it was the same people on every time. So it was a very nice way. So that's something to consider doing with your community as well.
Yeah, those are great. Those are such great ideas. Yeah. So here's some other information. So kind of like why are people over 60 or people with illnesses most at risk? So this was also from the grand rounds we had here at UNM, and it said that, you know, the majority of people, so not to like stress people out, the majority of the diseases, that disease is going to be mild, right? So 81% of all people who get sick are going to have very mild disease. There's 14% who are going to have severe disease, and then 5% who are going to have like very critical illness. So I don't want to like scare people and be like, oh my gosh, anyone who gets COVID-19, they're going to get super ill. The majority of people aren't going to get ill. And just as Dr. Wilson was saying also, it's really your underlying illnesses that are going to make you more sick, right? So if you're super healthy, 80-year-old, you're probably, you know, less than if you had all the other illnesses like high blood pressure, diabetes, and a lung disease. Overall, they're saying the death rate is between 2.3 and 3%. If you compare that to flu, it's 0.1%. It's just that more people have gotten flu over time, and there's more people getting sick from flu. But now with the COVID-19, you know, we're going to see like a group that hasn't been exposed to COVID-19. So there's probably, you know, if we don't try to contain it, more people could get very sick, especially those who are 70 to 79 years old and greater than 80 years old. So 70 to 79 years old had an 8% rate of death, and greater than 80 had a 14%. And once again, that was because a lot of people who are older have those underlying illnesses as well. So this is another question. Is there a vaccine for COVID-19? And no, not at this time, but there are efforts to have a vaccine that they're saying between 18 and 24 months, they could have a vaccine already. The question is there a medicine for COVID-19? And really there is no medicine except for supportive care at this time.
Can you define supportive care?
Oh, sorry. Supportive care is like, so like if you get sick at your home, you know, making sure you're comfortable and you're drinking fluids and, you know, you're keeping your fever down with Tylenol or acetaminophen. The other thing is then if you do get really sick and you end up in the hospital, making sure you have oxygen. And then if you need a ventilator, making sure you have a ventilator. And that's kind of, I think, part of the reason behind the containment idea is that the more people we can prevent from getting the illness at all, the more people we can prevent from actually having to need a ventilator or getting that sick, right? So how are we protecting ourselves as a community is really important. Especially for us, I think a lot of us who work as community health workers or do community health worker work, we're working with people who are really vulnerable, who may not have health insurance. We're working with people who won't have access, you know, they won't have access to this, you know, for all the gels, you know, they don't have access to getting the health care that we will all get really quickly, you know, and so that's kind of like part of our reason for just trying to think, how are we helping each other as a community?
We also work with, this is Venice, we also work with immigrant communities. So there's also been word on, you know, I'm afraid to go to the doctor. I'm afraid to get this bill. So it's also that information and that population that we're working with.
Yeah, and you guys have such an important role in that. The other question is, should I wear a mask? So masks outside the healthcare setting, like CDC does not recommend, recommending, once again, that hand washing is more effective, and that just makes sense, right? Because the droplets and everything, you're trying to get them off your hands. Masks on a plane, not shown to be helpful. And then the other thing is wearing masks can actually reduce the global supply of face masks for health workers and people taking care of patients at home. And that also might have a lot to do with you guys who are working with patients at home or visiting elderly who may be sick. You guys do need a mask if you're going to go visit a patient who's sick with a respiratory illness. But if everybody else takes them and just uses them for their, I don't know, everyday life, then we won't have enough masks for the whole, you know, the whole country. So the other question is who should use face masks then? So basically what they're doing here is that any individual who has a symptom of respiratory infection, such as coughing, sneezing, or fever, needs to wear a mask so that you don't get those, you know, it stops the respiratory droplets from shooting out, right? The healthcare workers who are taking care of or in close contact with people who are sick, you know, who are going to be closer than 3 feet to a person, also should be wearing a mask. Healthy people, once again, do not need to wear a mask to protect themselves. So these are just some issues about masks. We have 2 community health worker programs, one that works in the PDR and one that works in the ER. And it is important that people who are going to be examining patients or being 3 feet or closer to a patient needs to wear a face mask, and not the N95 respirator mask, but just the regular surgical mask, right? And they should be thrown away after seeing a patient, especially if they're coughing on you. And then if a patient doesn't have any respiratory symptoms, though, you do not need a mask. And the only people who need the N95s are those who are like caring for the COVID-19 patients and also like in the hospital. So I think those are important things because I have seen people walking around with the N95s or you know, with face masks that are surgical masks when they actually don't really need that. I don't know if anyone has any comments about the face mask issue. Okay. These are just some recommendations on how to put on a face mask if you are going to be seeing a patient with respiratory illness. Those of you who are doing home visits or, you know, caring for somebody in the home with a respiratory illness, you know, washing your hands for the 20 seconds before you put on the mask, placing your face mask over your nose and mouth and making sure there's like a tight seal as best as you can. Avoid touching the front of the face mask, because if you do, as once again, those are respiratory droplets. You just like touching a table that someone just coughed on. And then remove the face mask without touching the front, and then throw it away in a closed bin when you're done, and then wash your hands again for 20 seconds. So those are just some recommendations about the face mask use. Does anyone have any questions about the face mask piece? Because that was a piece that I learned a lot just like by reading all the CDC recommendations and WHO ones. But I don't know if Dr. Pacheco, he's also seeing a lot of patients in the rural community. If you have anything to say about the face mask.
We're going to unmute him.
Okay, we're going to unmute you, Dr. Pacheco.
Yeah, I think you covered it. I don't have anything to add.
Okay. All right, thanks. Okay. This is another key question for people in New Mexico. Is there COVID-19 testing in New Mexico? And yes, the testing is available to all people through the New Mexico Department of Health. They recently updated the guidelines, and the reason why we want to have like weekly calls with you guys is because things are changing every day. I think tonight they're gonna like update update the recommendations again. But as of right now, testing is available to anyone who has fever and cough or shortness of breath who tests first initially negative for influenza, regardless of travel history or contact with confirmed cases. So first you have to test, because obviously most commonly you're gonna have influenza, right? So if you test negative for that, then you're gonna get the COVID-19 test. It has to be approved by the New Mexico Department of Health, and it's done through like a nasal or an oral swab or a sputum if your cough is a productive cough, like there's coughing stuff.
Can I ask a question? So when you mean testing is available to all people through Department of Health, does that mean that I'm showing the symptoms, I go to the clinic and they'll test me there? Are you saying that it's the Department of Health provides the testing to the actual clinic or hospital? Right. Is that correct? I don't go to the
Yeah, you don't have to go to the
Okay,
Department of
got
Health.
it.
Everyone does have slightly different protocols of, whether it's, if you're going through UNM or Mario's clinic has a slightly different protocol. So it's really important to have people call their own health providers about what they need to do. And once again, there's also a hotline here, so people can call the hotline. If the hotline does take a little while to get through to, if you are at UNM and you want to know about the travel restrictions, it's actually some recommendations were recently made at UNM to not use public transportation, that they're canceling all university level travel to CDC level 2 and 3 countries, and also domestic areas. There's a list of states: Rhode Island, New York, California, Washington State, Florida, Oregon, Maryland, Utah, New Jersey, and Kentucky. A lot of states that's based on whether or not they declared a state of emergency. So these are our UNM community health workers, just so you know that that's what's going on.
And this is very specific to New Mexico.
Yes.
Definitely check within your own state, your resources as well.
Absolutely.
Did you tell Travis Leva from DOH just chatted in and said that
Thank you, Travis.
that the public health offices are not doing testing for COVID-19.
Oh, okay. But they're providing the test kits. Is that correct?
Travis, can I
Can
unmute you?
Yes, Travis. Can you talk? Share that with us, all the information. Hi, Travis.
How you doing, guys?
Hey.
Yeah, no,
We can barely hear you, so you might want to speak a little bit closer or get closer to your mic.
but you know what? I don't know where the mic is in this room. Anyway, can you hear me there?
Oh,
Yes,
yeah.
much
Hi,
better.
Travis. Thanks.
Okay. Anyways, I'll just be brief. Yeah. So we're not doing any testing at our public health offices. What we're recommending is that you go through your PCP medical provider, and then, or even an emergency room through the local hospital. What we're doing as Department of Health is we're working with the primary care physicians and associations and hospitals to ensure that we're following the CDC guidelines. So in a couple of slides ago, it is correct. I mean, everything's going through us, but that's just because we're kind of like double checking the criteria. And at the time, right now, what we're doing is we're sending all the, let's say you go to Presbyterian Hospital in Albuquerque and you go, you're sick and everything, and you meet the criteria, let's just say, you get tested, they are sending it directly to our SLD lab there in Albuquerque. And then they're going to go ahead and provide the results. But, and every time that happens, the PCP or the hospital physicians, whoever it is, they report it to our ERD. So that way we're on top of it. And then we kind of make sure that the criteria is met. And that's really the key, is that the criteria is met. It is true, we're actually setting up some sentinel flu sites to kind of see if we can track coronavirus that way as well, but that's kind of in the works right now. But for right now, yeah, we're just advising, and some of you may have seen the governor's press release, press conferences this afternoon. They're talking a lot about it, and she's giving the same information that we're giving here in this echo, but really we're talking about the testing. We want to make sure that it's streamlined. And if there's ever a question about the testing, so if any promotoras, any community health workers have any questions, I highly recommend that we use the 505-827-0006, the 666 hotline. That's 24/7 hotline number that's directly to ERD. That way, if you are a medical professional or not, and you have lots of questions about getting tested, definitely reach out to that ERD hotline number. That's the 505-827-0006. Okay, just wanted to leave with that.
Oh, Travis, can we ask you another question?
Sure.
This is great. I'm so glad you're on the line. So what is your recommendation for if you're a community health worker and you're meeting up with someone in the community that has cough or fever, what is your recommendation for them to do then? Because are you asking people to, self-isolate, or what is the recommendation by DOH right now?
So right now, I'm going to talk from my standpoint with the Office of Border Health, and also the community health workers we have working for us. So I'll tell you some of the precautions that we're going to be implementing here very soon. Right now, we're doing harm reduction and harm reduction services in and out of our public health offices, and also in outreach settings. And what we're recommending right now is to limit the actual exposure. So a great example is in one of our public health offices, you literally have to go through 2 waiting rooms and actually a set of offices to get to a harm reduction room. So our promotora has to go through all these areas with the person there. So what we're doing is we're actually moving the harm reduction room to a bigger room, so that it's a streamlined, one way in, one way out, and there's no, we're limiting the contact of people. So that's what we're recommending right now at this time for our community health workers, is to limit the interaction. Now, again, if someone's coughing, someone's sneezing, they feel under the weather, that's something that we want to be able to find out beforehand. And that's why we're going to sit together and talk about a strategy of how we can talk to the clients that we serve. Because if we can postpone the services, if we can get someone to come get their services for them, we can start looking at some exceptions or ways around the way we usually provide these services. We're going to go that route. But right now, limiting the contact is probably number one. That's probably the best recommendation right now. You had it on the slides. If you're not sick, you don't have to go around wearing masks and gloves and all that. But again, when we're working one-on-one with folks, we too want to protect ourselves if the client themselves is ill. So that's some of the recommendations that we want to do as well. We want to be able to say, hey, if you're going to still provide the service and folks are, feeling under the weather, maybe a little common cold, little bug, could be flu, could be coronavirus. I mean, we just don't know. We want to just use these universal precautions that we're doing to make sure that everyone just limits the contact. The slide about the 3 to 6 feet, I think that's great. That's something to really instill into folks. You know, not the handshaking. I know it's customary for us to want to shake hands with everybody. But right now, maybe, you know, elbow bumping or just giving an air high five, that's probably the best way to go. Just to, you know, alleviate some of the panic around folks, because we're getting that already with clients. They're already looking at us and saying, oh my God, I don't want to come to the office. I'm just not going to get my supplies this month because I don't want to deal with me getting sick. Totally understandable. But now we have the communication line. You know, the great thing is we have technology like Echo, you know, like Zoom. We have cell phones. If we can limit some of that close 3 feet, 6 feet contact, let's do it, and let's use our technology. So right now, again, that's a recommendation. Again, I'm not, you know, an authority to give a recommendation from DOH, but definitely from the Office of Border Health and the community health workers we have working down here with us, that's definitely the route we're going to go.
Oh, thank you so much, Travis, for the ideas, suggestions. I think what you pointed out is definitely you all checking back with your organization, your clinic, around what is being done. You guys are being very proactive in regards to even changing how people come in and where you're putting individuals. So our plan, and I will announce it at the end, is also to have a weekly session where we can update the newest information, but also share. I would hope that we'd have an opportunity to share what clinics and organizations are doing. Then it's a learning community. So thank you so much, and thank you for that whole team that's there participating.
Yeah, no, thank you. And I just wanted to also just mention, maybe for the next round, is, you know, most federal agencies, state agencies, and big organizations, they do have a continuity of operations plan, a COOP plan. And that's really that's basically what we're working off, is we're going off our COOP plan to say, okay, we're not at a tier 4, you know, surveillance is heightened, awareness is heightened, this is how we're going to practice. You know, if we go to a tier 3, which is a little, you know, higher scale, then, you know, again, we're, you know, if this, then that. So, I mean, I would, you know, just advise from another state agency to everyone online is to say, you know, check in with your agencies and see if you have a continuity of operations plan, a COOP plan, because I bet you do. And, you know, maybe it's the time to start bringing it out and start working on that. Okay, thanks.
Thank you so much.
Thank you. Yeah, that's great. So yeah, thank you so much. Thanks for all the updates. Also, I'm so excited that Border Health and all your community health worker program is going on there. I just wanted to summarize with just this one slide that's from the CDC website, which is, you know, a very simple slide about helping prevent the respiratory disease spread. Just like Travis said, avoiding close contact with people, covering your cough or sneeze with a tissue and throwing it in the trash, avoiding touching your eyes, nose, and mouth, cleaning and disinfecting frequently touched objects and surfaces, staying home when you're sick except to get medical care, and then washing your hands with soap and water. So pretty simple things to share. I think it's just hard to do. And I think that's why community health workers is such an important part of this whole response. I think that at the end of the day, you guys are going to be the people who are making the biggest difference in the community, because you're going to be the front line to prevent this, and also to be there for people when they are isolated. We have one more slide here that's just about like how we're screening people in New Mexico. So this is some educational materials like we're going to share with all of you. I mean, I think it's pretty easy to access. There's a lot of different types of materials that's available, and you guys probably have some too that you can share. So if you have some cool stuff that you want to share with us, we'd love to have that too. And then, yeah, like just kind of some thoughts, like what are our thoughts here as a group about what should be our role as community health workers in the coronavirus pandemic, or things that you guys have done. We want to learn from you as well. So
So you can chat us in, or for those we could see, you can raise your hand. Are we getting any chats? So again, I'll repeat the question. What should our role be in the coronavirus pandemic? Okay, I see one hand, and then hopefully chats will start to come in.
Hello again. I feel like our roles are kind of dependent on what we do in the communities. So for example, my group works with people who have respiratory disorders already. So part of what we're gonna have to do is education of our participants, keeping everybody informed, telling them where to go. And I think generally our main role should be providing support and helping people understand that they're probably going to be in that 81% of mild cases if they ever catch it, and reassuring people.
Yes, that's great. Thank you. Anybody else?
Thank you for sharing. Virginia, you have some. Do you want to read them out?
So we have Denise asking about how about an advisory call with the NACHW, so the National Association of CHWs, there we go. We should dispel myths and ensure access. And then Suzanne also chatted in that she thinks we need to continue to educate, to wash hands, and keep referring them to the CDC guidelines. And if I can piggyback that with an earlier comment that Elizabeth had chatted in regarding a source for that, there is a website called washyourlyrics.com. So it is in the chat, but we'll put it back up there. Basically, it gives people 20 seconds of various song options in case singing Happy Birthday twice isn't really up your alley. You can go pick out a favorite song and then gives them something to do while they're washing. So I think that's a great idea.
What else? Thank you so much for those comments.
Sure. And then I like that one. I like that education to dispel rumors. Information is being updated so quickly, and people are connected to social media and spreading rumors. So that's actually really cool. Like, yeah, making sure everyone's updated. I think even us, like, we're providers and we're like having to update quickly as well. So I think that information is super, super important.
Right, because as community health workers, they come to us for information. We're trusted individuals, but it's also okay to say if you don't know the answer to the question, and hopefully we've provided resources to you all that you can use, because that's a good way of referring individuals if you don't have the answer. I mean, we don't want to continue with giving misinformation. We want to make sure that we have the correct, accurate information. Yeah. What about other chats that we're seeing here?
We have a lot of questions that have kind of come in, but we're not, I thought there was a little bit more slides, so I don't know.
Okay. Well, let's see what else. We'll stick to this question of what else could we do in our role, and then we'll make sure we answer some questions before we wrap up. So, Paige, you want to read one of them?
Sure, yeah. So Mariah chatted in that I think education and prevention around the virus is important. So for example, an inmate expressed that they are experiencing some anxiety about the virus since the pods have a lot of people. And I shared with them that the best thing we can do right now is wash our hands and cover our coughs and sneezes. And I think that's smart. Somebody else up top, Suzanne Smith, said that we needed to somebody else said, Aurora said to keep clients calm and informed. And I think that's really important. So that myth dispelling piece and making sure that people are calm but really well informed.
And I think also, this is Venice again, just sharing my experience is I've been hearing a lot about obviously the virus, right? And it's easy to become scared, to become nervous around and thinking about your family, but I have to also remind myself I am a leader. I want to be proactive, and fear cannot overtake. I need to be proactive in this. And what was that proactiveness mean to me? And it is to provide education, making sure that we have echoes like this to share the information. Because if we have the fear, definitely others will sense that fear.
A lot of questions, so let's make sure we have time for that.
Perfect. So let's, I think we're going to go ahead and go back to questions. There was a lot of questions that were sent in. And
I guess I'd like to unmute Dr. Mario Pacheco and Dr. Bronwyn Wilson to kind of go over these kind of last like UNM protocol and also help to answer some of those questions. So over there, Bronwyn, yeah, there, and then Bronwyn Wilson is the other one. Yeah, thanks. Oh, yes. So I thought maybe Dr. Wilson could share a little bit about what the current UNM protocol is, and then when we look at the questions, maybe we can answer them, some of them, or just as a group answer some questions. Okay. So I don't know, Dr. Wilson, can you hear us?
Yeah, no. So the slide that you've showed here with the hospital protocol. So if somebody goes into the, to say the UNM urgent care or to the emergency room, this is what they can expect, that they're going to be asked questions about recent travel or any exposure to people with known illnesses. And then probably if they are having a cough or fever, they'll get a mask put on immediately. I know they're going to be having special rooms where they're going to put people that are possibly have a respiratory illness. They won't know exactly what it is. That they'll be put into a special room so that other patients who are waiting with other problems will be separated, as I'm sure that is going to happen. And then the university hospital guidelines are for both the this one that you're showing is for the inpatient and emergency room and urgent care. And I suspect that all the clinics, because we have many clinics, family medicine clinics, or all sorts of different clinics, will be getting guidelines, and the medical directors and unit directors there will also have protocols in place so that they're people who just walk in, how will they be treated? How quickly will they respond? And having them, like you were talking about earlier, the right equipment to take care of that. So I think it's going to be a good resource for folks who don't know what to do or go. A lot of people don't have, primary care physicians, unfortunately. Access can be a problem, but I think that our hospital has always had the philosophy that everybody's welcome to at least get screened and get help. And that's just important to know.
Dr. Pacheco, oh, sorry, does Dr. Pacheco, do you have anything to share? Thank you so much, Dr. Wilson.
So I would just add how quickly that this information is changing, that not only the countries that are identified previously, but areas within the United States also are now being added to that list. I would just comment that for the rural health clinics and areas, this is one of many situations where it's really beneficial, I think, to be in the rural area, because you're automatically a little bit more isolated. And for those of you who are in a position to give a suggestion, talk with your community, I think before anyone travels in to a clinic site, they should call. And I think this epidemiology number that Travis gave us is very helpful to get an idea, do I need to go in or not? And can we avoid being in a clinical situation where we expose other patients, other hospital staff, while providing the care that is needed? So calling your clinic provider and knowing that this epidemiology number is available 24/7 is a really important thing for people to do before they come into a clinic or into an emergency room, especially when you're in a rural area.
Great. So let's see, I think we have one more slide here just to show you the resources, the places where we got all this information from, so that we'll send those out and you'll have access to all those resources. And then also there's the hotline over there. And maybe if we can open it up, open back the questions, and we'll have Dr. Wilson and Dr. Pacheco also be unmuted so we can answer those questions. Those final questions. Yeah, okay.
Sure, and Michael is raising his hand.
Oh, Michael. Okay, yes, please.
You're unmuted, Michael.
We can't hear you yet, though.
Oh,
I don't know if it's a.
we'll have IT chat you and we will come right back. Okay, so yeah.
So we'll try to answer your questions, and if we can't answer the questions, we'll find them out, and then we'll just kind of have a running question thing if you want to email us, and then we can find out the questions for you next week. So kind of a learning community. Yeah. And if anyone else has the answers, feel free to answer.
All right, so you want to read some, Virginia?
Sure. And real quick before we do that, I just want to point out I just put up the email to email us. It's chwecho@salud.unm.edu. So you can send extra questions there. All right. So, and I believe this one was Michael's question. I think there's a lot of questions, but it was about social distancing in the refugee shelters. He wanted to know about increasing ventilation and the airflow, if that is a way to help. They're contemplating doing outdoor tents as a means to getting that distance between people, but so I guess the heart of it is, does airflow help, and with separating people outside be effective?
So, Michael, you're working, I'm also working at the West Side Shelter, and having a similar problem of trying to figure out how do we get better airflow. I think, yes, better airflow is better. Having people be outside is better where air is circulating. I think once we're like clumped into non-circulating areas, then we're increasing our risk for the infection. I think in those areas, what we've been doing at West Side Shelter is making sure that we're washing hands and disinfecting areas more. But that is a concern, and I think between all of us, if we're thinking about this, is I think we should I don't know, we should look for how we can best do this, because I think we're very concerned here, and I think anyone who works in prisons or homeless shelters, or like you said, refugee camps, how are we assuring that people aren't getting sick in those areas? That's something we're looking to try to figure out too. So any information anyone gets for next week, please share, because I think we're still trying to figure that out. Does anyone else have anything they've done for that situation? So we can put that down as a learning issue for next week to see if we can find out if there are other people who have experienced that, and reach out to all our contacts. Yeah.
Thank you.
Thanks.
What other questions do we have, Virginia? Do you want to read them out?
Sure. So the next one is about anemia, people with anemia as being an at-risk group. And what about people with blood clotting disorders? And there's a follow-up about kids with chronic disease already, and whether or not home visiting is wise for them in that role. So,
So I'm gonna see if Dr. Wilson or Dr. Pacheco want to share anything about that.
Well, I think that with the clotting disorders, I mean, it's less a problem of immune system, but on the other hand, often these things are not in isolation. So depending on the reason for it. So I would imagine that anybody who has a chronic condition that, needs medical care or has to come in should continue to receive the care for their underlying condition, and probably consider themselves to be possibly, more vulnerable than the general population that don't have those other comorbidities or other risk factors.
And then regarding the children, this is an interesting thing. So when they looked at all the children who they saw in China, it was a case report of 72,000 people. There were no child deaths at all under 9 years old. There are no children. So interestingly, this illness doesn't really affect children as much as adults. I don't have information about, do children with underlying chronic diseases have more of a chance of being ill than others? I do think that the home visiting thing, I still think that there's not, I looked up recommendations around home visitation and there wasn't any, but I think thinking about common sense and, making sure that if we're ill, we shouldn't go visit any home visiting sites, you know, and then if the people you're visiting are ill, to make sure you bring some face masks to cover them, and make sure you're washing your hands and cleaning surfaces. And then, because it does seem sad if we don't visit our home visiting people, but at the same time we want to be like thoughtful about how we're doing the home visitation and making sure we're following some of those social distancing things perhaps. Or like someone said, you know, do we use Zoom or do we call by phone to our home visiting clients, you know? So I think these are all things that are, and I think this is what's great about having so many CHWs together on one call, is like maybe you guys have had ideas about how to do the home visiting as well. But
yeah, and one thing we were talking about yesterday, an important thing to note is, so this is, we have a Zoom license that allows us to have these longer sessions, but you can sign up for a free Zoom license online, and you can have at least 45 minutes for free, with some sort of maximum capacity for how many people can be on that session. But if you are looking for a way to try to do some of those home visits with folks who have enough kind of technological literacy to kind of work with you on Zoom, I know that's not an option for everybody, but that is one resource that's available for free for folks to use if they're trying to limit their contact with folks individually.
And then someone actually, I do think someone had a very important chat up there that says, how will we address CHWs who might be ill but have no sick time? Will we as a community advocate for this workforce? Yeah, I think that is so important because, oh yeah, that's so important because, yeah, and I guess how can we do that? Advocate for that. I think all of us where we are need to be advocating for that, especially those who have some control over budgets, is the importance of advocating for when someone's sick for 14 days, how are we making sure we can make sure they can be sick for 14 days, you know? That's a really good point.
Yeah, because there's other questions, if they run out of paid time off, sick leave, yeah.
Yeah, I think this is a big concern kind of overarchingly for the CHW workforce just generally, and has always been. And I think that this is really bringing that to light more now than ever before. So I know that question was from Denise, who is actually the director of the National Association of Community Health Workers. So Denise, I think we're really going to lean on you for some leadership for this kind of advocacy.
Although we did have a chat from David Mamey, who said that his hospital has decided to approve allowing staff to go into the negative if they run out of paid time off or sick leave, and allow them to pay it off later. So that might be a conversation that, again, people with at the budgetary level can start talking about and advocating for. So thanks, David.
And then I run, so there's a lot of community navigators here from the Pathways program, and also from the Resource Reentry program. Those programs I do oversee. That is something that I will be working on to figure those pieces out.
That's great. See, there you go. Yay, that's awesome.
We might have a separate echo with Denise. That might be another separate echo to start brainstorming some of what's happening.
Awesome. All right, so we have somebody else that chatted in with our telemedicine doctors, good resources for those who want to minimize the community exposure. And I think that is around the idea that maybe not everybody that is sick wants to do it, but they don't want to go down to the hospitals. Yeah, so with the,
Oh, absolutely. I think they're thinking about, at least at our hospital, I think they're moving towards trying to do some more telemedicine because of that. Like, I think that's going to be, this is going to be something that will move more quickly towards telemedicine because there's a concern about people being exposed. Yeah.
And I think along a similar note, encouraging folks who are doing elective operations, they can potentially postpone, thinking about that as well, putting those off until fears are a little lower.
all right, so the next question is asking us for any recommendations about an asymptomatic person that recently traveled to a state that is in a state of emergency for COVID-19, and then returned and their company shut down with a confirmed case. that they had been asking about. I don't know if it was around the idea of somebody being asymptomatic and their likelihood of getting it, I'm imagining.
So an asymptomatic person that is a positive confirmed case, is that correct?
No, they were out of state in an area that has COVID-19. They've returned, and now their company has had a separate confirmed case. And I believe they might be on quarantine. I don't remember if I'm trying to find it again to see if we can.
That's what they're asking us to do too. So if we go to another country that has active COVID-19 community spread, and like, so let's say I go to, let's say I go to Maryland right now, which has declared a state of emergency where my parents are, and I come back from there, then they are asking me to do self-quarantine, like self-isolation for 14 days to prevent any kind of potential spread. So they are actually suggesting that right now to us as a university, that if we go to any, so yeah, I think that, I hope that answers the question, because that's what's happening here.
Yeah, and I think the question might have been what to recommend to that person. And if anyone is ever in doubt and they have the ability to work from home for 2 weeks, I think that's always going to be the choice. I know a lot of, if not most of the community members that we work with as CHWs will not have that privilege. But if they do, definitely recommend that they take it.
Is there other questions?
Although David had just chatted into the team, so. Yeah, so I guess in response to that, David Mamey says that his hospital has just let staff know anyone who travels to the level 3 country will be on a mandatory 14-day quarantine before they can come back to work. And it seems like Elizabeth as well, so that's pretty popular.
And where is David from? What state? David, I just want to clarify that way.
Oh, Hawaii. Aloha. Oh my gosh, that's great. That's awesome.
All right, well, thanks, David and Elizabeth. The next question we had was around protective clothing for community health workers or frontline health workers. Other than masks, is there any other protective clothing? And is there anything that they should be giving to the community?
Good question.
That's a really good question. I don't believe there's any protective clothing that, there's not a recommendation around protective clothing except for the people. I believe I'll ask, I'll defer to Dr. Wilson and Dr. Pacheco as well, but I don't believe that there's any kind of specific protective clothing, except once again, like washing your hands, and then the respiratory illness, people having the mask on. I don't know if, you guys have any other thoughts on protective clothing? Dr. Pacheco or Wilson?
I don't think there's any recommendations on that unless obviously if you have a confirmed case, but I haven't heard anything.
No, I agree with that. I think it's more if the people know that they have the virus, that's different, and they're interacting within closer than the 3 feet, then they should have protective clothing. But just visiting, doing home visits with people that don't have a known case of this virus, there isn't really anything that you could do.
And I'll add something quickly. I know best practices just generally for wearing scrubs if you're working in a clinical environment is to change as soon as you get home before interacting with your family and wash that well. So that's one way just generally to cut down on the transmission of flu and cold and any other type of transmissible illness. So following that would not hurt.
Thank you. That's true. Yeah. Oh, also, this is an important thing too. Like, little kids don't tend to get a bad case of coronavirus, but they do tend to be a good vector for that because a lot of them get sick, so that's also an important thing to remember too. It's like, like being around a lot of little kids too, you just have to also remember, that they can actually spread the virus pretty easily as well.
We've got 10 minutes left.
All right, what other questions do we have?
I have just a couple. One is, how long does it take for Clorox or a disinfectant like that to kill the virus on the surface?
I actually read that last night, and it's just kind of instantaneous. You know, as long as you're like cleaning it off, and it's a disinfectant, like an alcohol-based disinfectant, like Lysol or anything like that, it'll just come off as soon as you wash it. Is what I understood from what I looked up last night.
Okay, thank you.
I think that's correct. I think it's going to just interrupt with the virus envelope, the part of the virus, so it would get rid of it on contact.
And then I think we've kind of covered the other two questions I had written down, but Elizabeth just chatted in. Is there any further info on the steroid question? Is it any specific type, or is it all steroid?
So I also read that last night, but I think Dr. Wilson and Pacheco can say something about that too, about, you know, there was some data showing that steroids could make it worse. I don't know if that's what you guys understand as well.
So I haven't seen.
Well, I think there's, okay.
I haven't seen any data on that, but it would make sense because since steroids, especially over the long term, are immunosuppressants that would increase your susceptibility to any kind of infection, including this virus. But I don't know of any specific interaction other than that would increase risks.
Sorry, we're having a little trouble understanding you, but I think what you said was that the steroids could immunosuppress you, so that could potentially make it worse. Is that correct?
Yes, I think that would probably be the likely relationship, is the immunosuppression effects of long-term steroids.
Mm-hmm. Okay. And I don't know, I think Dr. Wilson was going to also mention something.
Yeah, I think it also depends on the delivery system. So a lot of people use inhaled steroids for their lungs, which is much more focused. And you have to have always the risk benefit between breathing or not breathing, if that's really keeping the airway inflammation down, which is what the steroids do. And so people can breathe easily. I would imagine that's a discussion with their individual healthcare provider about what are the risks and benefits. We give a lot of steroids at this time of year, like people can buy them over the counter for their allergy symptoms, right? The Flonase and those sorts of things, which are very local use of steroids, which it probably has a less of a risk than if you're taking pills that have steroids in them. And I think the data, I suspect, was the trial to have high dose steroids to see if it would help the virus response to the virus in a positive way, and it turned out to be in a negative way. So I think it's different than somebody who takes the chronic steroids for allergies or asthma treatment.
Yeah, that's what I read last night. Yeah, it was just like when you were in the when you were hospitalized and they were trying out high dose steroids, that those were the ones that got worse. They weren't talking about like people who were using inhaled corticosteroids for asthma or anything like that. Yeah.
Right. Yeah.
Okay. All right, everybody. So before we wrap up, I'll go over next steps. And so there is a survey link that was attached to the announcement. We definitely want to hear your feedback. I will say that literally this was organized probably within 2 days. And we quickly pulled together the resources to make this happen. I want to give a special thanks to Dr. Pacheco, Dr. William, because we know that pulling this off very quickly, and you're also seeing patients, and definitely Dr. Bahun, who has literally been up all night preparing for this presentation to get this information to everybody, and the participation from everybody. We had a total of 120 at most. 120 individuals from pretty much all across the country. Our plan is to make these available to you, so we definitely want your feedback. So fill out that survey. And
the survey link is in the chat too.
It's in the chat, she just sent it. Also, our plan is to do weekly sessions to update you the most updated information. And our plan is to continue to do them every Wednesday, starting New Mexico time at 3:30 to 4:30. Am I correct, team? Okay. And again, we also sent that information, the email address for you to send additional questions. We highly recommend for people to try to get on video. We had a ton of people on phone, and I know this is the first time some of you guys are joining. If we want to make it participatory, it is helpful to see people on video. What else am I missing, team? Anything else that you guys would like to share before we wrap up?
I just want to thank you guys for all the work you do in the communities, and that is such a amazing privilege to be with you guys today. Yeah, what you guys are doing.
Any other final comments or thoughts?
So everybody who chatted in their email, we've got down, but if you haven't sent us your email address yet, I know there's a lot of folks who got forwarded this invite, so we don't have your contact information. So if you would like follow-up information, please make sure you put your email address in the chat, because otherwise we'll have no way to contact you, and we want to contact you. So all of the emails that we have, we will send out these slides and the questions and the answers, and we will send out information for next week's session. But if we don't have your chat, then just join by the same link next week at 3:30 Mountain Time, and we will be here. So when in doubt, you can use that same link again.
You can always reach out to the CHW echo@salud.unm.edu email. I monitor that one every day. So
And again, final thoughts is definitely thank you for being proactive, good public health workers, CHWs. It's really, this is going to involve everybody. So the better informed we are, the better we could do our work. And I'll end it with that.
well, thank you.
Thank you, everybody.
Thank you.
See you next week.